Namaskar. It's time for us to begin a new session today. So, welcome to all of you. Uh, it's a pleasure to come back to you again after our successful events in the last 5 months. In fact, every month we are doing a new virtual event on a different topic. And we are very happy to have the kind of support from the audience. Today's live event is in line with our thinking to organize such sharing and learning every month. And the purpose is to share more, learn more, and do better. This is a collective platform to search for solutions on different aspects of leprosy, and in the process also make community aware of the kind of sufferings of leprosy and the role which they can play. As we begin the sessions today, I now formally welcome our guests, speakers, and audience for this very important event today. Our chief guest today is Madam Dr. Jaya Delvi, State Leprosy Officer, Uttar Pradesh. Our special guest today is Dr. Shantanu Rakshit, District Nucleus Team Medical Officer, District Bankura, Government of West Bengal. And our guest of honor is Mr. Rajnikant Singh, State Coordinator, Bihar Lepra Society. Today's event is about a very important component of caring for the affected with some kind of disability, some kind of physical challenge. So this is going to talk about the self-care models, the different self-care models which NLR India has been implementing for the last almost 24 years now, with great partnership with the government, community, and of course the affected people. This event attempts to share experiences, issues, and lessons. For your kind information, we will be completing this event in 1 hour's time, and we request your full participation and kindly ask your questions. You can ask your questions by putting your question in the comment box, or towards the end, uh, you can raise your hand and our backend team will allow you into the speakers room to ask your question directly to the speakers. Without any further ado, I now request my colleague, Dr. Praveen Kumar, Head of Programs, NLR India, to give an introduction of this initiative. Dr. Praveen, please.
Thank you, sir. I think I am visible and audible.
You're not audible. Dr. Praveen, you're not audible.
Is it okay now? Is it better?
No, no.
Okay, let me check with the technical team, sir.
No, still we cannot hear you, Dr. Praveen.
Just give me 1 second.
We cannot hear you, Dr. Praveen.
Hello.
No, it's okay. Let him. But it's okay. Close the notes.
Okay. So So it seems that some technical issues there with the let me start without much ado, because the time is limited. So thank you, sir, and namaskar and good afternoon to all. Let me share my screen, then I'll start my presentation. Is it visible now, my presentation? Anybody?
Yes.
Okay.
Yes,
So thank you, and welcome to this session. I will go quickly through this presentation just to introduce about self-care. Self-care, as you know, is a very important intervention for managing disability in both the cases of leprosy and lymphatic filariasis. Lymphatic filariasis and leprosy are among the most debilitating diseases in the world, and both are related to stigma and discrimination because of disability they are able to cause. So the efforts that exclusively done by a disabled person by himself or herself to manage and prevent further worsening of the disability can be termed as self-care. So it is a group of simple methods and exercises which can help in improving the condition of disability, halting the progress of disability, and at times even reverse the disability. For example, somebody having claw hand due to leprosy, they can practice self-care and that claw hand can be very much improved. We will show you some pictures about that also later on. And similarly, if a lymphatic filariasis case with lymphedema having swelling in their legs, practice self-care, they are also able to minimize, at least to some extent, their swelling can be minimized to some extent. With the practice of self-care and the improvement of disability, the productivity of person increases, sense of stigma and discrimination does decrease. In NLR has been pioneer in self-care. It is the first organization to introduce self-care for leprosy patients. They started it in Bihar and Jharkhand in 2008. The self-care protocol was developed, shared with Government of India later. And NLR also started the combined self-care, a novel intervention in which both the patient of leprosy and lymphatic filariasis practiced self-care together at one place. NLR India also conceptualized the home-based self-care for the persons who can have the services of self-care right at their doorsteps, and this is being implemented in West Bengal. The objective of self-care projects are to empower and enable persons with disability due to leprosy and lymphatic filariasis to practice self-care in their respective homes, in their own, when they are trained. They are given some logistics also so that they can practice self-care at their homes. Then the health staffs are capacitated for self-care, how to conduct these self-care practices, and they are also trained on how to do sensory testing and voluntary muscle testing so that they can identify disability early. They are also trained on lymphatic filariasis, self-care that is applied to lymphatic filariasis, and also trained on how to identify and manage the entry points in patients. There is awareness generation about self-care and its usefulness among community members and leaders. And ultimately that is very useful when persons affected by leprosy or lymphatic filariasis are practicing self-care at their houses. The level of stigma discrimination becomes less. The different models of self-care that is practiced by NLR are self-care in leprosy colonies, self-care at health facilities, that is primary health centers and community health centers. The reason of the participants in the self-care camps in leprosy colonies are mostly or exclusively residents of leprosy colonies. So those who are living in community may not participate the self-care camp organized in leprosy colonies. So we thought of another model, that is self-care at health facilities, that is primary health center and community health centers. Yet another model is of combined self-care, in which, as I told you earlier, both persons affected by leprosy and lymphatic filariasis do attend self-care camps at health facilities. Then there is home-based self-care. I did discuss about this also a little bit. This is to provide regular services to all disabled leprosy patients at their doorstep by ASHAs. The monitoring and supervision is done by general healthcare staff, and this is being implemented in West Bengal, as I told you earlier. How we organize the self-care camps? Before organizing any camp, we go and brief the health officials at district and state and district levels and get their necessary directives for organizing this. The directives may be addressed to the district official from state and for block officials from district for organizing these camps. Then there is training of health staff on self-care that includes ST and VMT, entry point identification, etc. Formation of self-care groups with person affected and training them on self-care practices. The duration of self-care is 12 months with the first camp for case listing and assessment, and then subsequently 2 monthly and 3 quarterly camps. So in total, there are 6 camps in 12 months. Assistive devices are distributed and linkage to beneficiary schemes are also done. The photograph on the right side of your screen shows the booklet on which the records are maintained for self-care attendees. This photograph is for patients with leprosy. And the main points recorded are enumerated here: general information, assessment of general health, assessment of disabilities, status of reaction, grading, etc. And the records are analyzed at the end of year. The practice is being done for the lymphatic filariasis cases also, that the booklet is maintained, and these information enumerated on your screen are taken care of. The self-care project, these are some numbers in 6 NLR states. 133 self-care groups were formed, out in which 5,140 persons affected with leprosy and lymphatic filariasis were trained on self-care. 2,627 assistive devices were distributed, and we facilitated 197 patients for reconstructive surgery. This chart, this bar diagram shows how many self-care groups have been formed and how many persons have been trained state-wise. So you can see in Bihar, 39 groups, 2,575 persons trained. Similarly, in Uttar Pradesh, 54 groups and 1,705 persons trained. In total, there are 133 self-care groups formed, and 5,140 persons are trained. This is from 2019 to 23, that is 5 years data. Then improvement in ulcers in leprosy and swelling in lymphatic filariasis. You can see 70% of patients who had ulcers, if they practiced self-care, that was improved, and 72% of persons with lymphedema due to lymphatic filariasis, if they practiced self-care, their swellings reduced. These are few photographs. You can see reduction of swelling in lymphatic filariasis case. Other aspect which I told you earlier, that we train the general healthcare staffs also. So these are the numbers: 2,323 general healthcare staff were trained on self-care, and 2,670 were trained on ST and VMT. Identification of disabilities and self-care 4,437, and trained on identification of disability. This is among ASHA, that is 4437, and 294 DPO, PRI, and community-based organizations have been trained on self-care and identification of disability. This is for 5 years, last 5 years. This is the photograph where the person is seen. Their capacity is being built for examination of power and so on. These are some successes in India for NLR. NLR's self-care model for leprosy has been adopted by government of Bihar and Jharkhand in 2022. And now they are implemented across all districts, and we did supportive supervision, monitoring, and at times capacity building of all these persons who are involved in self-care service provision. So that concludes my presentation. Thank you.
Thank you, Dr. Soni, for the very good overview of the self-care projects which we are doing in the country. Now we will move to the field, and I will request Kashinath Chakravarti ji. He is our state community-based rehabilitation coordinator working in Jharkhand. So Kashinath ji, kindly present our work which we are doing in Jharkhand. Kashinath ji.
Thank you, sir. Arpit ji. Good afternoon, all. Myself, Kashinath Chakravarti, State CVR Coordinator, Jharkhand. I am presenting self-care project in Jharkhand implementation, impact and insights. Next, please. This is the self-care project in Jharkhand. In Jharkhand, the following models of self-care implemented, already discussed by Dr. Praveen sir. In this regard, I don't elaborate this year. Self-care in leprosy colony, self-care camps at primary health centers, and combined self-care of persons with disability due to leprosy and lymphatic fibrosis. First of all, we trained the persons affected by leprosy, then general healthcare staff trained so that they will able to supervise and monitor the self-care practices. With good and visible outcomes, members of the community and Panchayat Raj institutions members have supported the self-care activities. Next, please. This is there are already discussed self-care in leprosy colony started in November 2007 in our state Jharkhand. There are 33 colonies under state of Jharkhand NLR supported. By the end of 2015, more than 300 camps were done, including monitoring meetings. Already benefited 782 persons affected by leprosy trained and benefited. Out of that, 460 were ulcer cases, were healed 323, approximately 70%. Next, please. Self-care camps at primary health centers in Jharkhand. Self-care health facility, self-care camp at the primary health centers or community health centers. These are the all healthcare facilities started in 2012. This is a process already discussed by Dr. Praveen sir. Hence, a district level meeting with civil surgeon or district level officer. First of all, we brief them and get necessary directives. After that, one day training of the general healthcare staff on self-care. Next, we organize the training on self-care. Next, that is the we started. That is the combined self-care camp was started in 2015 at CSCs of PSCs. This was done in 37 CSCs in 12 districts. 700 leprosy affected persons and 348 LF cases have benefited by October 2023. In last 3 years, there were 65 ulcers healed out of 86. In lymphatic fibrosis, there was reduced swelling and no fresh attacks among the total 102 cases. Where 83 that is the reduced swelling and no fresh attacks, approximately 81%. Next, success. Support from the government and other stakeholders were increased. Assistive devices, self-care kits and MCR suits were provided for leprosy patients by the government. Facilitation by NLR. Morbidity management and disability prevention kit, MMDP kit provided by the National Vector-Borne Disease Control Program for lymphatic fibrosis patients. Pensions, rations and other facilities were made available through district social welfare officer, district livelihood promotion officer, etc. Improvement in self-esteem, less stigma and discrimination. The PWDs are found managing their disabilities and able to prevent worsening of the disabilities. Next, please. Most importantly, it is so pleasing to hear so many affected persons thanking NLR India by saying self-care has been of great help. Since 2021, the government of Jharkhand has scaled up of NLR India's self-care model in all its districts, though it is only leprosy self-care. हम लोग इसमें जो 2001 में एक हमारे डायरेक्टर डॉक्टर कृष्ण कुमार साहब एक लेटर इशू किए थे पूरा हमारे झारखंड स्टेट में 24 जिला में थ्रू सिविल सर्जन एंड डिस्ट्रिक्ट लेप्रोसी ऑफिसर के रिक्वेस्ट किया था अभी जाएगा जो है यही मॉडल इंप्लीमेंट होना चाहिए अभी भी चल रहा ओवरऑल डिसेबिलिटी स्टेटस ऑफ पर्सन्स प्रैक्टिसिंग सेल्फ केयर गॉट इम्प्रूव्ड नेक्स्ट प्लीज these are the few photographs already this is the ulcer cases showing improvement of the self care through practices only hope therapy hydro oleophysiotherapy by SSOD भी बोलते हैं soaking scraping oiling and dressing these are simple method next please these are the already this is also the already showed that is the ulcer healed next please only this is the clawing ulnar clawing is already after taking self care this will be improved next please this is also few challenges are there is often non-availability of dressing materials for self care field supervision monitoring and documentation by the general healthcare staff patients negligence towards their own ailments not practicing self care not wearing MCR suits because their prime income is the begging non-cooperative patients, several people from distant places and low socio-economic status are not able to join camps due to financial reasons. Severe ulcer cases could not join the camps. Next, please. Thank you. Thank you for your kind attention. Thank you very much.
Thanks, Kashinath ji, for describing the work very well of our Jharkhand. Next, I invite Dr. Abdullah. Dr. Abdullah, who is State Program Lead of NLR India in Uttar Pradesh. So he will be talking about our self-care program in Uttar Pradesh. Dr. Abdullah, please.
Thank you so much, sir. Arpit ji. So good afternoon, everyone. Myself, Dr. Mohammed Abdullah. I'm working as a state program lead in Uttar Pradesh for NLR India. And today we are discussing the self-care project implemented in Uttar Pradesh. What are the impacts and what are the insights? Next. So experiencing and implementation of self-care. So first of all, I will talk about them in the implementation, the people who are involved. First and foremost, the state leprosy officer, then the district leprosy officer, district leprosy consultant, the medical officers in charge, ASHA and general healthcare worker, also the pradhans of the leprosy colonies. So for the starting the self-care camp, the advocacy meeting is required with the government officials and later the issue to the concerned chief medical officers and the DLOs of the respective districts. The CMOs and DLOs then issue the letter to the concerned MOICs of the health center where the camp has been organized. NLR staff will conduct training for staff at a district level, health center level for affected persons. Next. Proper follow-up of the patient should be taken before starting of the camp, either telephonically or via video call. Then linkage with the several referral services from the primary to tertiary level for expert management is required. Then arrangement of logistic for self-care camp, which is training has been provided by the government and any gaps should be identified by the NLR and supported. Also the facilitation of reconstructive surgery for the eligible persons. Next. So these are some pictures for the of advocacy meeting with the district staff. Next. So talking about the self-care model, the self-care model is first implemented in leprosy colonies from 2010 to 2011. It is implemented in 24 leprosy colonies in 11 districts. Then the self-care camps is at primary health centers from 2010 to 2014. It is implemented in 32 health centers in 23 districts. Then from 2015 onwards, combined self-care camp has been implemented for leprosy patient, also for the lymphatic filariasis patients. It is implemented in 61 community health centers, primary health centers in 12 districts of Uttar Pradesh. Next. Combined self-care. It is basically a self-care camp for both the patient of leprosy and LF. Both are trained on to practice self-care in the camps organized at health facilities. The monitoring and supervision of the camp is done by the general healthcare staff, which includes ASHA. They are also trained on the self-care. The general healthcare staff are also trained on sensory testing and voluntary muscle testing for early detection of disability in leprosy. Similarly, they are trained on identification and management of entry points in LF cases also. Next. So talking about the advantages, first and foremost, the self-care is important for both leprosy patient and LF patients. They are sitting together, practicing self-care will decrease their community stigma as well as discrimination. The neighboring cases can practice self-care together, leading to greater continuity. Easy for healthcare workers to mobilize, conduct camp, distribute assistive devices, and make follow-ups. Next. So from 2010 to 2023 till now, medical officers trained are 134, 929 paramedical staff, and 1,967 Asha Sagni has been trained till now, which make a total of 3,030. Next. So these are some pictures of the field of self-care practicing. Next. So for the success in the leprosy colonies, number of beneficiaries are 485, out of which 288 are male and 197 are female. The ulcer healed percentage is 81%, which is 145 patients out of 189. And at that time, 4 patients has been facilitated for RCS. Then self-care camp at CSCs and PSCs. The number of beneficiaries are 792, out of which 587 are male and 2005 are females. The ulcer heat percentage is 182, which is 139 out of 170, and 30 patient has been successfully facilitated for RCS. Then in combined self-care camp, leprosy patient 1,254, out of which 950 are male and 284 are female. The LF cases are 448, which is 251 male and 197 females. The ulcer heal percentage is 67, and the LF swelling reduced is 52%, which is 234 out of 448. And at that time, 49 patient has been successfully facilitated for reconstructive surgery. Next. So these are some before and after picture. Log thermos. Next. These are pictures of claw hands. Next. Next. Ulcer heal. Next. So talking about challenges which we face in the field, first of all is case dropping out in subsequent camps, then lack of regular self-care practice after completion of self-care camp, lack of sharing knowledge about self-care from senior staff to frontline worker, and LF cases are comparatively less in number as compared to the leprosy cases in the camps. So these are some key challenges which we face in the field. Next. Thank you so much for your attention.
Thank you. Thank you, Dr. Abdullah, for that very good presentation from Uttar Pradesh. Now we'll be playing a video, recorded video from West Bengal. And in West Bengal, we are doing a refinement of this self-care, and you will see it's really an innovative model, home-based care. Arpit, can you play the video, please?
Leprosy causes deformity and from that disability. So a good number of leprosy patients ends up with disability, and unfortunately disabilities are for their lifelong. It is a progressive and permanent. So in the state of West Bengal, nearly 19,000 such patients of leprosy with disability is there. And they are not getting a regular service. Government had a program which is known as Disability Prevention Medical Rehabilitation Camp, in short, DPMR camp. And government used to pay 3,000 to 4,000 rupees per camp once in a year in a block. But unfortunately, in a block, maybe there are 150 disabled patients, only 20 to 25% patient, they used to attend that particular camp. Unfortunately, most of the patient could not avail that opportunity, and those who attended the camp even, just they do not practice without a regular support. So NLR discussed this with the policymakers and submitted a plan that a regular, sustainable care for this disabled patient throughout the year by the government field worker called ASHA can be possible. So NLR started discussion with ASHAs, with the district officers, and ASHAs have only maybe one patient in her area. So it was not at all difficult for her to reach the patient once in a month to provide them some health self-care material, or just to ask, how are you? What is your problem? And they used to come back to the sub-center to report the ANMs there that this is the condition of the patient. And in a very basic documents prepared by NLR, they used to just document their observation every month. And this is called home-based self-care. And this is going on for last 3.5 years. And fortunately, yes, mini evaluation was done, and it was seen most of the patient got improved physically, ulcer healed, and the most important thing was psychologically, mentally, the patients were happy because of their long history of disabled period. Nobody came to them. Now Asha is going every month asking, how are you? And that created a lot of mental happiness for the patient. Also, it removed the stigma in the families, in the community. Now this home-based self-care is going on throughout the state. Most of the patients are getting a regular service, sustainable service, not dependent on NLR by the government system. NLR only facilitated the thing and implemented by government.
Thank you. Next, so we have heard about our different models of self-care. Now we will be hearing voices of the beneficiaries. Arpit, please.
मोरी सुहागी तहसील मऊरानीपुर। मेरा नाम हीरालाल कुशवाहा है। मैं ग्राम बमोरी सुहागी तहसील मऊरानीपुर जिला झांसी का रहने वाला हूँ। मुझे कुष्ठ की बीमारी हुई थी, यानी कुष्ठ रोग हुआ था। जो गांव की आशा कार्यकर्ता हैं, उन्होंने बताया कि आप CSC केंद्र बंगरा पर जाइए और वहाँ पर आपको इसका इलाज मिल जाएगा। तो मैंने वहाँ जाकर के CSC केंद्र पहुँच कर के डॉक्टरों से संपर्क किया, तो उन्होंने मुझे इलाज के लिए दवाइयाँ दी, और दवाइयों के बाद में उससे मुझे दवाइयाँ खाने के बाद में उसको काफ़ी उससे लाभ मिला। और इसके बाद में मेरे हाथ में कुष्ठ की बीमारी हो गई थी, तो उन्होंने बताया कि आप तेल लगा करके इस हाथ में मालिश करिए और पानी में भिगोइए, फिर धीमे धीमे उस सब उंगलियों के ऊपर मैंने धीमे धीमे पानी में उसको डुबो करके अपना इलाज डॉक्टरों से करवाया और साथ में दवाइयाँ खाई, साथ में अपना घर का जो है तेल लगा करके और मालिश करके हमने उसको हाथ की उंगलियों को सीधा किया। तो इसलिए मैं NLR फाउंडेशन का बहुत बहुत धन्यवाद देता हूँ।
हमारा नाम है सुभाष चंद्र महतो। हम जो सो हमारा पैर में घाव हुआ था, वो घाव जो सो ठीक नहीं हुआ था, तो सहिया ने बोली तो हम गए हॉस्पिटल, कैंप बैठा हुआ था। उसी टाइम में जो सो वहाँ जो सो हमको राजेश जी पहले देखे थे, वो जो सो हमको बताए, वो दवाई दिए, वो हम खा रहे थे। उसके बाद दूसरा कैंप बैठे, उसके बाद NLR जो सो वो जो सो हमको बताए हैं जिस तरीका उसी तरह हम किए तो हमारा घाव जो सो ठीक हो गया।
आप पैर उठा करके घाव को दिखाइए। बहुत अच्छा। पहले आपका यही घाव था, यही ना? एक घाव था आपका जो है। आप क्या क्या काम करते थोड़ा बता दीजिए
घाव
सबको।
जो सो उसमें पानी में पैर को आधा घंटा डुबाते थे। उसके बाद इसको जो सो हम तौलिया से रगड़ रगड़ के उसको पोंछते थे। उसके बाद जो सो हम कड़वा तेल मालिश करते थे।
अच्छा, तौलिया से कहाँ? उसको मैंने जो वो नमनिया है, नमी है, इसीलिए उसको जो है ये वाला साइड से आप ये करते थे।
इसमें हम पोंछ रहे थे, किनारे किनारे पोंछे।
अच्छा,
चारों तरफ पैर का।
अच्छा,
उसमें आप कड़वा तेल जो सो हम लगाते थे।
अच्छा, ठीक।
मालिश किए
हाँ।
तो हमारा घाव जो सो
बिल्कुल
सूखने लगा।
बहुत अच्छा। तूने जो है
धन्यवाद एनिलाल, हम आपको धन्यवाद करते हैं।
धन्यवाद देता हूं।
फायदा हुआ है।
आप पहले अपना नाम बताइए।
अनिता ठाकुर,
अच्छा, कहाँ का रहने वाली है?
पटना।
पटना में। ठीक है, इसके बाद आप बताइए क्या क्या काम करते हैं। जो कैंप में आई थी तो उसमें कि आपका पैर जो सूजा हुआ था कैसे था, आप बताइए अपना ऐसे।
पहले तो बढ़ गया था। उसके बाद जब वहाँ गए हम कैंप में तो फिर आप बता दिए हमको तो उसमें बहुत कम हुआ है और हल्का फुल्का है। और सब ठीक है।
आप कैसे कैसे क्या काम करते हैं पहले बताइए।
वही साबुन से धोते हैं, उसके बाद तौलिया से पोंछते हैं, उसके बाद तेल लगा के इसको ऊपर चढ़ाते हैं।
अच्छा, मतलब नीचे से ऊपर की तरफ से चढ़ाते हैं।
चढ़ाते और उसके बाद फिर अपना एक्सरसाइज करते हैं।
अच्छा,
एड़ी के भाग में
एड़ी के ये दबाव ठीक है। तो आपका बहुत फायदा हो रहा है।
बहुत फायदा हुआ।
हाँ, तो
सुबह मतलब रात को सोते हैं तो तकिया लगा के सो लेते हैं।
बहुत
उसके बाद लगा के सोते हैं तो सुबह हमको एकदम प्लेन हो जाता है।
बहुत अच्छा,
एकदम प्लेन। और अभी फिर चलते घूमते हैं तब थोड़ा सा
यह होता है। तो आपका बहुत फायदा हुआ।
बहुत फायदा हुआ।
तो हमारा यहाँ जो कस्मार के जो स्टाफ है, हमारे जो डीएल ऑफिस के स्टाफ है बोकारो से आए हैं आलम जी, हम सभी को जो है एनएलआर इंडिया फाउंडेशन की तरफ से बहुत बहुत धन्यवाद और आपको शुक्रिया देता हूँ जो आप लोग ढंग से कर रहे हैं। इसके लिए देखिए हमारा कॉम्बाइंड सेल्फ केयर कैम्प में बहुत अच्छा फायदा हुआ, इसलिए आप दोनों को बहुत बहुत धन्यवाद।
Thank you. So next we will also hear from our GSC staff and community leaders and PRI. Arpit, please.
नमस्कार, मेरा नाम डॉक्टर हुस्न बानो है। मैं डिस्ट्रिक्ट लेप्रोसी कंसल्टेंट डिस्ट्रिक्ट कन्नौज। हमारे यहाँ MMZ कैंप चलाया गया था NLR टीम के द्वारा। मंतोष कुमार महतो, डॉक्टर अब्दुल्ला और इन लोगों के द्वारा MMZ कैंप चलाया गया। 6 ब्लॉक में ये कैंप चला था जिसमें जो है ग्रेड 2 डिसेबिलिटी, ग्रेड 1 डिसेबिलिटी वाले पेशेंट को सेल्फ केयर के बारे में बताया गया और आशाओं को PMW को भी सेल्फ केयर के बारे में बताया गया। इसमें जो मरीज ग्रेड 2 डिसेबिलिटी के थे उन्हें सुबह शाम सेल्फ केयर के अभ्यास के बारे में बताया गया जिससे उन्हें जो है ना काफ़ी फ़ायदा मिला। समय समय पर जब उनकी मीटिंग होती थी तो वो बताते थे कि हमें किस तरह से इनमें फ़ायदा मिल रहा है। सेल्फ केयर प्रैक्टिस जो सुबह शाम करने को बताई गई उससे उन्हें बहुत फ़ायदा मिला। और जो हमारे आशा बहनों को भी ये सेल्फ केयर के बारे में प्रैक्टिस कराई गई उससे ये फ़ायदा हुआ कि पेशेंट को वो गांव में जब देखने जाती थी तो वो इसे मोटिवेट करती थी कि ये सेल्फ केयर जो है बार बार करते रहें जिससे जो है उन्हें आगे कॉन्ट्रैक्चर या फिर अल्सर होने से कैसे बचा जा सकता है। हमारे PMW को भी प्रॉपर ट्रेनिंग हो गई है सेल्फ केयर की जिससे जो है ना कोई भी पेशेंट अगर इनिशियल किसी कंडीशन में आता है तो वो सेल्फ केयर बताते हैं उन मरीजों को और जब वो अभ्यास करते हैं तो ये काफ़ी हद तक उन्हें आराम मिल जाता है। आगे 2015 में भी हमारे यहाँ 2 ब्लॉक में MMZ कैंप चला था जिसके बहुत ही अच्छे परिणाम देखने को मिले थे। आगे ये दोबारा से चला कैंप मैं चाहती हूँ कि इसी तरह के समय समय पर कैंप चलाए जाएं, जिससे कुछ रोगियों को ग्रेड 2 डिसेबिलिटी की तरफ जाने वाले कुछ रोगियों को आराम मिले। और बाकी जो है सबको इस तरह के सेल्फ केयर किट प्रोवाइड की गई थी। टब और वगैरह टॉवेल ये सब भी मरीजों को दिया गया, जिससे उन्हें काफ़ी राहत मिली। साथ में जो है फाइलेरिया का प्रोग्राम भी साथ में चल रहा था, जिससे जो है ना हम लोग जब नापते थे नेक्स्ट मीटिंग में तो उनकी स्वेलिंग में भी बहुत आराम मिलता था फाइलेरिया के भी मरीजों को, और स्पेशली कुष्ठ के मरीजों को इस सेल्फ केयर कैंप से बहुत ही ज़्यादा आराम मिला है। मैं धन्यवाद करना चाहूँगी NLR टीम का, जिन्होंने हमारे डिस्ट्रिक्ट को चुना, हमारे मरीजों को इतना अच्छा सा अभ्यास करने के बारे में बताया, जिससे उन्हें आगे की डिसेबिलिटी से रोका जा सकता है। धन्यवाद।
मैं राजेश कुमार PMW। मैं कस्बार में 7 साल से लेप्रोसी प्रोग्राम में काम कर रहा हूँ और शुरू से ही हम लोगों के ऊपर NLR का सहयोग बना रहा है और उम्मीद करते हैं कि आगे भी इसी तरह का सहयोग हम लोग को NLR टीम से मिलता रहे। अभी हम लोग हाल फिलहाल में ही हमारा एक प्रोग्राम हुआ था LCDC, जिसमें NLR द्वारा केस वेरिफिकेशन में हम लोग को बहुत सहयोग मिला और NLR टीम के द्वारा ग्रेड 2 पेशेंट के लिए सेल्फ केयर के बारे में बहुत सारी चीज़ें बताई गई थी, जिसमें वो सब प्रैक्टिस हम लोगों ने पेशेंट को बताया और उस प्रैक्टिस से रोगियों का घाव भी बहुत ठीक हुआ। यही कि NLR टीम से हम लोग का यही उम्मीद है कि आगे भी इसी तरह का सहयोग बनता रहे।
नमस्कार, मेरा नाम गिरजेश गुप्ता है। मैं उत्तर प्रदेश के जनपद शाहजहांपुर के ब्लॉक पुमाया में पैरामेडिकल वर्कर के पद पर कार्यरत हूं। राष्ट्रीय कुष्ठ उन्मूलन कार्यक्रम के तहत हमारे सामुदायिक स्वास्थ्य केंद्र पर जो ग्रेड 1 और 2 के कुष्ठ प्रभावित दिव्यांगजन पंजीकृत हैं, उनके लिए समय समय पर विश्वविख्यात संस्था जो है NLR इंडिया फाउंडेशन, उसके सौजन्य से संयुक्त शिविर आयोजित किए जाते हैं। कंबाइंड जो कैंप्स हैं ऑर्गेनाइज किए जाते हैं, जिनमें कि लेप्रोसी के साथ साथ लिम्फेटिक फाइलेरिसिस के जो एलिजिबल कॉन्टैक्ट्स हैं, जो पेशेंट्स हैं, उनके सेल्फ केयर के लिए डेमोन्स्ट्रेशन और ट्रेनिंग दी जाती है। इन शिविरों में सेल्फ केयर का अभ्यास करने और प्रशिक्षण लेने के लिए पात्र लाभार्थियों को मेरे द्वारा CSC पर बुलाया जाता है और उनके बैठने की समुचित व्यवस्था की जाती है। ट्रेनिंग के दौरान NLR इंडिया फाउंडेशन से CVR कोऑर्डिनेटर मिस्टर मंतोष जी के द्वारा बताए गए सेल्फ केयर के तरीकों से बहुत से बेनिफिशरीज को काफ़ी लाभ हुआ है और कई केसेस में तो देखने को मिला है कि जब से उन्होंने ट्रेनिंग ली है और घर पर रेगुलर प्रैक्टिस शुरू की है, तब से उनके प्रभावित अंगों में जो है उनकी स्थिति में काफ़ी हद तक सुधार आया है। इन शिविरों में CHC के समस्त स्टाफ के साथ साथ फ्रंट लाइन वर्कर्स जो हैं वो उनको भी शामिल किया जाता है, ताकि वो प्रशिक्षण लेकर और बाद में भी लाभार्थियों तक जो है वो अपनी सेवाएं पहुंचाते रहें, उनकी निगरानी करते रहें, उनकी मॉनिटरिंग करते रहें। ये कैंप्स अलग अलग कंडक्ट ना करके कंबाइंड इसलिए किए जाते हैं ताकि दोनों प्रकार के यानी लेप्रोसी और लिम्फेटिक फाइलेरिसिस के जो भी एलिजिबल पेशेंट्स हैं उनको एक साथ एक छत के नीचे एक ही प्रक्रिया के माध्यम से सेल्फ केयर का प्रशिक्षण दिया जा सके। इससे दोनों प्रकार के रोगी एक साथ मिलकर प्रशिक्षण में भाग लेते हैं और लाभ उठाते हैं। इससे लेप्रोसी पेशेंट्स के प्रभावित अंगों में जो एनेस्थीसिया है उसके कारण जो अल्सर होते हैं तो वो भी ठीक हो जाते हैं और जो ग्रेडिंग ऑफ डिसेबिलिटी है उसमें भी बढ़ोतरी आगे नहीं हो पाती है। और लिम्फेटिक फाइलेरिसिस के रोगियों को फायदा ये होता है कि उनके प्रभावित अंगों में जो स्वेलिंग होती है वो रिड्यूस होती है। दूसरा ये कि जो अक्यूट अटैक्स आते हैं उनमें भी जो है काफी कमी होती है, लगभग बंद हो जाते हैं। और जो पैरों में फंगल इन्फेक्शन होता है बार बार, तो वो भी जो है बिल्कुल समाप्त हो जाता है। इवेंचुअली मैं ऐसे कन्वीनियंट, स्टैंडर्ड एंड कंसिक्वेंशियल सेल्फ केयर ट्रेनिंग्स के लिए NLR इंडिया फाउंडेशन, स्पेशली मिस्टर मंतूष जी का हृदय से आभार व्यक्त करता हूं। धन्यवाद।
प्रणाम, मैं NLR से आया हूं, आपका बहुत नाम सुना हूं। मैं आपका मुखारबिंदु से कुछ सुनना चाहता हूं। आप मुखिया है, आप कुछ बताइए सेल्फ केयर के बारे में। जो स्वरक्षा अभ्यास शिविर जो आयोजन किया गया था हंटरगंज में, आप इनके बारे में कुछ बताइए।
जी सर, जब शिविर लगता है तो मेरा लगभग अहम भूमिका होता है, क्योंकि हमको स्वास्थ्य से लोगों का स्वयं देखभाल से, स्वयं केयर से हमको बहुत इच्छा होता है कि लोग विकलांग ना रहें, उनको कोई किसी तरह का रोग ना हो। इसके लिए शिविर में हम हमेशा लोगों को पहुंचाने का काम करते हैं, सहयोग करते हैं। और सर हॉस्पिटल में जो हैं उनके द्वारा भी काफ़ी सहयोग मिलता है हम लोगों को, सभी चीज़ों के बारे में जानकारी देते हैं। और हम लोग ऐसे मरीज को वहाँ पहुँचा देते हैं जो दवा और व्यायाम से इलाज हो सके। आँख, हाथ, पैर, जो इस तरह का बीमारी है उसके लिए हम वहाँ तक पहुँचाने का काम करते हैं। वैसे मरीज भी हैं जो काफ़ी वहाँ भर्ती होने लायक होते हैं, उसको भी हम लोग वहाँ पहुँचाते हैं। जैसे महिलाएं हैं या बच्चे हैं, सबको हम लोग वहाँ पहुँचाने का काम करते हैं सर। और कोशिश करते हैं कि कोई ऐसा विकलांगता से ना जिए, सबकी आज़ादी है अच्छे बन के जीने का। और काफ़ी लोगों का रिजल्ट भी मिल रहा है जो दिखाई दे रहे हैं सर, और काफ़ी अच्छा दिख रहा है। मैं आपको भी धन्यवाद देना चाहूँगी, हमारे हॉस्पिटल के सर को भी धन्यवाद देना चाहूँगी, क्योंकि आप NLR इंडिया फाउंडेशन को मैं काफ़ी धन्यवाद देना चाहूँगी, क्योंकि वो इस तरह का कार्यक्रम को चला रहे हैं और यहाँ मरीज ठीक हो रहे हैं।
कुष्ठ रोग से जो विकलांग रोगी हम लोग ठीक कर रहे हैं, हम लोग ट्रेनिंग दे रहा हूँ। अच्छा, इसके बाद आपका बहुत बड़ा अहम भूमिका होता है जो विकलांग रोगी। आप तो उनको हम सुने हैं, आप उनको पेंशन की व्यवस्था करा देते हैं और समाज कल्याण पदाधिकारी से मिल करके आपने बहुत सारे सुचारू ढंग से आपका काम भी करते हैं। और आपने सुना हूँ जो आपने जो विकलांग रोगी है जिसका जो सहायक उपकरण की जरूरत है, उनको भी समाज कल्याण पदाधिकारी से मिल करके आप ये भी काम करते हैं।
जी सर,
तो बहुत बहुत धन्यवाद। मैं NLR इंडिया फाउंडेशन से आपको तहे दिल से शुक्रिया अदा करते हैं। बहुत बहुत धन्यवाद।
मेरा नाम साय गायत्री कुमारी है, मैं मनसा सिंह गेट आसादान लेप्रोसी कॉलोनी में रहती हूँ। मैं यहाँ एक्सचेंज एजेंट के रूप में हूँ और हमारे यहाँ काशीनाथ सर आते हैं और यहाँ एक सेल्फ केयर कैंप चलता है, वहाँ लोग अपनी मर्जी से आते हैं। और मैं यहाँ देखती हूँ किसी के पैर वगैरह में अगर घाव है तो मैं काशीनाथ जी को बताती हूँ और उनके तरफ से हमारे यहाँ कुछ सहायता मिलती है, जैसे बैंडेज वगैरह। और जो बच्चे पढ़ते हैं, नहीं भी पढ़ते, वो भी मैं बताती हूँ और बहुत कुछ वहाँ से हेल्प मिलता है NLR की तरफ से।
So far we have heard from NLR, we have heard from the stakeholders, the affected people, the general healthcare staff, the Ashas. Then we have also heard from Panchayat representative and also a change agent. So this feedback is very encouraging to us and which helps us in doing better. So next now we move on to our guests, and the first guest which I request to kindly present is Rajni ji. Rajni ji from Lepra Society. He is the state coordinator Bihar. Rajni ji, please. Lepra Society is an honorable partner of NLR India. Rajni ji.
Thank you very much. Am I audible?
Yes, you are audible, Rajni ji.
So thank you very much. And I first thanks to Ashok ji and whole NLR team for inviting me for such great session and important session. I can say the self-care, because is not very well understood by the policy people and the program managers, because we are talking about mainly detection and diagnosis and treatment, and then but someone who have a disability is need whole life care. So, and I saw this very great initiative in the kind of project in the different states, and we have a heard voice. Only I am working also since 93 in this field of leprosy with the lepra. And my experience is saying is a self-care people start, but I find out people dropped. So I ask an interview, in-depth interview with these people. And the one things I find out, actually, they don't know why they are doing. If you ask, and they will simply told because Dr. Sahab have told me. So they don't know why they are doing their washing, is removing hard skin, dressing. So they don't know. So this is the one of the reason. And because this is need every day. If you ask someone to do every day, it definitely is a. So that's why I believe when I came in the lepra, if you have a 5 component of self-care in your program will be the excellent. What is this 5 component? Is the skin care, wound care, exercises may be passive or active, protective footwear, and also the health education and counseling. Without that, if any pillar is a missing, again your program will be somewhere is going to fall. We have also very good experience in lepra, and now we have a self-support group. Means every country have their self-care group, self-support group, self-help group. But our self-support group is a person who is affected with the lymphatic filariasis and leprosy is only in this group, and they are supporting each other in terms of the like recently they are helping in the making UDID card, because they somehow know the government of Bihar commissioner has issued letter, the disability letter is a grade 3 or age above can be disability and can get the social benefit declared by the state government. So now this our people is started talking about this. So I think self support group or self care group, if involvement with the some financial microfinancial kind of livelihood, and also the UDID or social welfare scheme definitely is going to stay longer in the community. And the main thing is we always talk not only self-care, because self-care is improving the well-being. When I'm saying well-being, is a physical, mental, social, and economical. Because if I have ulcer, I cannot go in the field. I cannot go in the field. I cannot earn money. I cannot earn money. I cannot send my children. I cannot have a good food. So many things is there. So in the last only I can say, and we have a one project with the Liverpool School of Tropical Medicine, Ethiopia, India, and Bangladesh, and we are testing a model which is a CBG model, community-based model, and this is 30-month project as a operational research mode, and maybe we will come back with some good things, and definitely we will share, because NLR is also we are working very together very closely in the Bihar and Jharkhand. So, and Ashok ji is a guru. Sometimes I learn from my patient also. So my patient is my guru also. That's why I learn this thing. So with this, because time is a limit, so I'm ending my thing. And again, once thank you to the NLR whole team, and congratulations for organizing. And I request, please organize something more like this so that we can all benefited in this forum. Thank you very much, sir.
Thanks, Rajni. And you made very important points. Like one of the very important point which you said is the person needs to understand why it is important to continue self-care, right? And also you said it's not only care, but we should also support them socially, mentally, and also on livelihood, economically. So thank you, Rajni. So next I call upon Dr. Shantanu. He is District Utility Medical Officer from Bankura, Government of West Bengal, and he will be talking on the experience of home-based care, which is an innovation in self-care. To the audience and other guests, sorry, we are running a little late today because of the technical glitches. Hope you will continue to remain with us for another 15 minutes. Thank you. Sir, Dr. Shantanu, please.
Thank you, sir. Am I audible?
You're audible.
Good afternoon, everybody. I am myself Dr. Shantanu Rokit, MODNT, now posted at Bankura in West Bengal. Today, now I am starting disability. Disability can be prevented. It is done by only early detection through routine program, campaign, not only campaign also contact examination and through contact examination. Though we have to manage including complication like type 1 reaction, mainly neuritis. And to prevent the worsening of disability, this is prevented by providing medical services and some medical aids and appliances. Next of all, why the present situation in our state? Nearly 19,000 leprosy disabled patients are enlisted in our community. It is detected only through two programs. One is DPMR camp, which is held once or twice in a year in every block. And in that camp, a limited number of patients can able to attend there. As because they are dwelling at a very remote corner in a village that is very remote corner to the block, therefore they are quite impossible to attend the camp. And also through the RCS screening and in case of the training of FLW. Next. Therefore, we are. I think home-based DPMR service, home-based self-care service is very effective to those patients, those are suffering from disability. It is a unique program in for more than last few years. The program was conducted in our state, in which the ASA provides their services to the with basic material at the house of the patient in every month, and they not only that but also they keep the records of the regarding the condition of the patient in a Bengali record book. Therefore, it is we are able to cover most of the patient, most of the disabled patient. We are as because we are able to provide them service, and it is done at regular basis. And due to home-based DPMR, home-based self-care service, we got every information regarding the patient, the current status of the patient, mainly his economical condition and ulcer, the condition of the ulcer, condition of the if the patient have some problem like deformity, all the information we may arrive from that. And home-based self-care service is done. Regular follow-up is also done. In this process, we can provide them mental support and also reduce stigma. Thank you, sir. Thanks to every person of NLR.
Thanks. Thanks, Dr. Shantanu. Thanks for working on this innovative model and very kind words. Thank you. Thank you, Dr. Shantanu. Next, I would request our board trustee, Madam Professor Dr. Archana Singhal. Madam, you're there?
Yeah, can you hear me?
Welcome, madam.
I'm not able to, thank you. I'm not able to switch on, turn on my camera. So good evening, everyone, all the esteemed guests, speakers, NLR family, and the attending this online virtual program, which is targeted at learning from self-care projects implemented by NLR India. So we are basically talking about two diseases, leprosy and lymphatic filariasis, and both have in common many things. They cause severe disfigurements, disability, deformity, and they negatively affect the social, mental, economical well-being of the patients. Because they are, and social integration is very important. So both these diseases need holistic management, in the sense they need pharmacotherapy, that means medicine, but that is not enough. Indeed, they need more is the self care, which is post treatment and during the treatment, and it has to continue lifelong if we want them to integrate in the society. If we just want to be like one of us. And I must congratulate NLR India for initiating this very brilliant initiative of self-care project, and the governments of different states for supporting this project. And what a network that they have created, a hierarchy starting from ASHA, ANMs, paramedical staff, medical officers, district leprosy officers, and everyone who help patients in training the self-care practices, which has to go lifelong. So it's very, very important. And another important thing in addition to this morbidity management is that these things should be easily accessible, like the dressing material. They should not be something very fancy which we cannot procure, or they should not be very expensive which cannot be sustained for a long time. So I think to ensure sustainability, a supervision is must. As some speaker said that the defaulters are many. So they should know why they are doing it, because it's a very, very rewarding exercise to help someone get rid of their ulcers, to help someone get rid of their hand deformity by either by physiotherapy or reconstructive surgery. This is very important, that it should be sustained lifelong after their medical treatment is over. So I think I want to applaud each and everyone who is involved in this brilliant initiative, especially the the frontline workers who are there to train the patient, their family, and their gram mukhias and everyone who is supporting it. So thank you very much, and all the best for this initiative.
Thanks, madam. Thanks for your kind words. They always guide us. Thank you, madam. Next, I may request our honorable chief guest, and she is the State Leprosy Officer, Government of Uttar Pradesh, Madam Dr. Jaya Dehlvi. Madam, kindly give your keynote address.
My video is not on, I think. Am I audible?
Yes, madam, you are audible. You are audible.
Okay, okay. So a big thanks to NLR for the honor bestowed on me. NLR has been very supportive and instrumental in successful implementation of the programs of the NLEP. From time to time, I have been receiving information from the work territory of Dr. Abdullah. The feedback given by him are very helpful, but at the same time, the Varanasi division and the adjoining area are deprived of NLR's intervention. I'm very happy that NLR took note of it, and the entire division has been handed over to Dr. Abdullah. Let's see the results. Our chief aim is to ultimately reduce or completely eradicate grade 2 disability. In fact, leprosy should no longer be an issue of concern, whether it is a social stigma or deformity. I, as a state head of leprosy, am concerned with the hidden cases of leprosy and grade 2, if any, which are hidden. So my request to NLR to help my team, that is the NLEP team, in monitoring and surveillance, and also training, of course, which they are doing and are committed to do. India being the most populous state, there are 75 districts. So you can very well understand it is for you also, it is very difficult to cater to the need of India bol gayi main. It is Uttar Pradesh, the most populous state. There are about 12,000 medical officers and about 2,000 Ayush medical officers. Then coming to the physiotherapist, we have 38 physiotherapists which need to be trained, at least oriented for grade 2 disability. This is my input. So I hope it won't be taken otherwise, but as a state head, I need to give some input also. There are positive things. So there are some negative things also. Uh, Ultimately, our aim is to eradicate leprosy with the help of you, of course. About ASHAs are about 15 lakh and about 6,645 CHOs. DLCs, there are 33 DLCs and there are 79 colonies. Why I am sharing this kind of detail on this platform is probably we are hitting the wrong nail. We are focusing more on the Kusht colonies, that is the so-called Kusht ashrams, and Asha Sangini. I would ask you to just up the slide shown by. Let me just open it. The slide shown by Mr. Abdullah. So I think what I feel personally is the focus should not be just the leprosy colonies. Repeated training in the colonies is a somewhat suboptimal use of the HR and the valuable resources. Leprosy colonies are not promoted these days just to abolish the social stigma attached to leprosy patients. I mean, we should go beyond that. Focus to be shifted to recent cases or those who haven't received these services at any point of time. So this is my input, and it's a vast area. So many medical officers need to be trained, so many ashas to be trained. So it is better to train a medical officer or a consultant or a physiotherapist rather than training and concentrating on asha. And downline training would be more beneficial. A concentrated training to DLCs and physiotherapists would be more a better approach, what I feel. And thank you so much for giving me this platform to share my views. I think that's all from my side.
Yeah, so thank you, madam. Thanks for the feedback. And let me also try to explain things a bit. We started with the leprosy colony model way back in 2024, and gradually now majorly our work is at the PSC. So Abdullah will further present that slide to you and clarify how your feedback is very helpful to us. Thank you, madam. Next session is on question and answers. And do we have questions? Let me check in the chat box if we have questions there. I don't see any question there. But अगर आप लोग ऑडियंस में से कोई भी प्रश्न पूछना चाहता है तो you can raise your hand and our backend team will include you in the room, in the speaker's room, and we can directly answer your question. Okay, I don't think there is any question, so we will go ahead. And for well, there is one question. Sanjeev Jain. Arpit, can you include Sanjeev Jain in the room? Arpit, can we see Sanjeev Jain? He can ask a question directly then. Sanjeev ji. Yes, Sanjeev ji.
Yes, sir. Yeah.
Yes.
Thank you. Thank you, Dr. Saab. It's a beautiful initiative, wonderful initiative. I just wanted to, it's not a question, but it's a comment actually. I just wanted to share that, you know, what I have seen with leprosy, that you have made champions, people who have been treated successfully. And they are the motivators, you know, they are the people when they come forward in the masses, then they motivate the hidden cases to come forward and take treatment. So we still have a lot of stigma which we have not been able to address so far from the national level, from the state level. And one of the best strategy is to bring the champions forward, the people who have been treated successfully, if they can share stories. So you know, they are the people who will bring the other hidden people forward. So this is just I wanted to share, and thank you again for including me into the group. Thank you.
Thanks, Sanjeev ji, for your comment. Definitely, I mean, we need to promote champions, right? And that's one of our important initiatives. Dr. Sudhir, Dr. Sudhir, please. Arpit, kindly include Dr. Sudhir. Yes, Dr. Sudhir, kindly ask your question.
सर मैं ये जानना चाहता हूँ कि जिन पेशेंट्स की आरसीएस हो जाती है, आरसीएस के बाद क्रॉ हैंड करेक्ट हो गया और वो वर्किंग कंडीशन में आ जाते हैं, तो उनको पेंशन दी जा सकती है?
ये डिफिकल्ट क्वेश्चन है एक्चुअली, मेरे को इसका उत्तर नहीं पता है. Who knows from okay, I think Madam Jaya, Dr. Jaya would want to respond to it. Madam Dr. Jaya, you would want to respond to this question of Dr.
Yes.
Sudhir? Yes.
Yes. They are eligible for the pension.
Okay, thank you, madam.
So RCS हो जाने के बाद भी पेंशन मिलेगी. Thank you. Okay. Anyone else? और कोई किसी का प्रश्न है जो हम लोग कोशिश कर सकते हैं उत्तर देने का? Okay. So thank you. Thanks a lot. Now let me conclude the session. The key lessons that came out of this event are: one is adoption of self-care model has reduced sufferings and given relief. Self-care camps, they do help in supporting mobility with social participation and work. As people get better, they can also work. The key needs which have come out of this event are that self-care, which like three states rather, West Bengal, where it is being implemented across the state, and a new model, home-based care. Then we have PSC-based models, which are being implemented across Jharkhand and Bihar by those state governments. So maybe this kind of model is implemented by other states across all the districts. And NLR, within its limited means, would be helpful to provide the technical support. Of course, like we do require greater collaboration between two departments, which is leprosy departments and LF departments. Like we have seen the results of combined self-care, and we also heard Dr. Rajini talking about it. But that combined self-care model is yet to be replicated. It's only present wherever we are directly doing it, along with, of course, the local district health facility. But it has not, we don't see it being replicated by other districts in those states. There is a need of continued and a greater supply of self-care kits. Of course, like as we heard that it's not only the healing of the wound or getting back the energy in the limbs, but the affected also require support in the means of livelihood support, also sometimes support on mental well-being and vocational training, education support for their children. So those are other areas which need to be looked in. So thank you, audience. It was great to have you. Now I may request Dr. Suchitra Lissam to give her vote of thanks. Dr. Suchitra, please.
Namaskar and good evening, everyone. At the outset, I sincerely thank Dr. Jaya Dehelvi, Madam, State Leprosy Officer, Uttar Pradesh, and Honorable Chief Guest of today's live virtual event for presiding this gathering and for delivering a very inspiring keynote address that will help in improving NLR India's work in self-care related support rendered to service providers and the need to have concentrated focus training. I take this opportunity to express my thanks to Mr. Rajni Khan Singh, State Coordinator of Bihar from Lepra Society, for being with us today as our guest of honor. Your presence in this meeting has immensely enhanced the importance of partnership in strengthening and streamlining support on self-care activities by Lepra Society and other ILEP agencies. I must express my gratitude to Dr. Santanu Rakshit, Medical Officer, District Nucleus Team, Bankura District, Government of West Bengal, for joining us as special guests and for providing your oversight and guidance in project activities. I sincerely thank speakers who are representative from general healthcare staff, community leaders, Panchayat Raj institutions, and beneficiaries from our project areas for sharing their experiences about your roles and work of NLR in self-care. I express my gratitude to Dr. Archana Singhal, Trustee of NLR India's Governing Board, for joining us today and sharing your insight about quality care on self-care that should be holistic in manner. Thank you, Madam, for your inspiring speech. I thank all our NLR speakers for their very good presentations and other colleagues for their contribution and support in this live event. Lastly, I thank Dr. Ashok Agarwal, Country Director of NLR India, for his overall direction and guidance in all of our endeavors. The passion to serve our beneficiary has been instilled in us through Sir's dedication and action to uplift marginalized population. Lastly, my thank goes to all those who have joined us today virtually from across the states, districts, and from other parts of the world. Thank you all. Have a wonderful evening.